If you're in your early 40s, female, not sick, but feeling off, this is for you. You might be sleeping, but not well. You're working out, nothing's working. You're more irritable than you used to be. A lot of people will tell you it's probably just stress, and a lot of it could be stress because you have a lot going on, but it could also be perimenopause. I relate a lot of this is very similar to pregnancy. When people are pregnant, a lot of times they feel swollen, short of breath. They could just be absolutely exhausted. And it could be a lot of things, right? So if someone has chest pain, short of breath, a lot of times they could be sick or they could be pregnant. And I find a lot of that is the same with perimenopause. It's a bunch of these random symptoms that come together that seem like you can't really put a finger on it, and it could be so many other things, which makes it really tricky and why a lot of providers try to avoid this whole perimenopause conversation, because it's really hard to diagnose and it's very hard to figure out what it is because it's not just one thing and you don't have all the time those very typical menopause symptoms. Like you'll go to the doctor and they'll tell you, okay, but you don't have hot flashes, you don't have night sweats, you're still getting your period every month, your cycles might just be getting a little shorter, and you can't really put your finger on what's causing it. And especially when someone is in their 40s, a lot of times it's a time in people's lives where a lot of times they have kids or a career. They have a lot of things going on that make people just say it's stress. And it could be stress. And it could also be perimenopause. So menopause has a very specific definition. And the definition is no periods without another medical reason causing it for a year. That day is considered menopause. Before then is perimenopause. After that is postmenopause. And what we're talking about here is a time leading up, and those changes tend to happen. And what happens is you're born with a bunch of eggs in your ovaries and they happen to have a decline. And in that time before, imagine you have the eggs being developed every month, and that basically there's signals from your brain that tells your ovaries to produce hormones. Sometimes it can last up to 10 years before that date. And there could be these changes, and the main changes have to do with the cycle changes. So in the first part of your cycle is like the estrogen dominant part of the cycle, but to create that, you need your ovaries to be functioning. Imagine when you're young, you have a bunch of these eggs in your ovaries that your brain tells your ovaries to produce hormones, and now imagine they're still there, but it's taking more work for that to happen. And because of those changes, people's cycles start to get shorter, and instead of having this nice curve of hormones, sometimes it gets a little more chaotic. And those changes in hormones tend to lead to a bunch of other symptoms. So one of the most common symptoms, and for me it's usually the one that happens first, is, as far as what the complaint is sleep changes. A lot of people will tell me, hey, all of a sudden I have a lot harder time sleeping. And they tell me they're sleeping lighter, that they're waking up in the middle of the night, and I see a lot of patients start going on, sometimes even the psychiatrist will put them on trazodone, or they'll put them on another thing saying stress is causing these changes. And what happens too is a lot of doctors will give people hormone panels and they'll just come out completely normal, so they don't assume a hormonal change. Generally, people's hormones, when they're dropping, there tends to be a drop of testosterone, which kind of changes independently from estrogen and progesterone. It's not in that big menopausal drive, but that tends to lower with age. But then the progesterone drops first, and then the estrogen does. And that progesterone tends to interact with these hormones in your brain called GABA. And GABA does a few interesting things, but one of the things that it does really well is it tends to lower stress and help with sleep. So I'll tell you a story. I had a patient, she was 42 years old, and she came in and she was complaining about sleeping. And she was saying it was getting harder and harder. They started giving her some Ambien. She was being prescribed some Ambien, and she just could not get a good night's sleep. They did a hormone panel on her, and everything looked normal. So I just want to take this second to explain. Generally, when people do hormone panels, they test people on day like 2 or 3 in their cycle. And at that time, progesterone is always really low. And when you're doing a hormone panel, you're taking a screenshot of a specific part of the cycle. You're not seeing what's happening in the whole cycle. So if you told me your progesterone was less than 0.5, congratulations, you're normal. Because in that part of the cycle, that's exactly where it should be. But it doesn't tell you what's happening in the other part of the cycle. Yes, you can check someone's progesterone in the second part, you do like a day 21 progesterone to see what that is. But generally, we don't sit around checking people's hormones every day. And a lot of times, because of when and how we check people's hormones, we tend to dismiss it and say there's no hormonal issue. Which is really interesting because as OBGYNs, we're really fast to just give people like synthetic hormones like birth control, but wouldn't consider giving someone a trial of progesterone to see if it helps them sleep. And when you take progesterone orally, it tends to also have some conversion to other molecules that increase GABA and help people sleep. And I've given progesterone to patients that are going through this perimenopausal time, and I've been able to get them off other sleeping medications that they were reliant on for sleep and had massive increased. And because of that, it tends to massively increase their quality of life. A second really common symptom that I get complaints of is joint stiffness, which for me, originally when I was starting, it was something I put down a lot because I suffer a lot from joint stiffness. People are going through perimenopause, there tends to be changes in estrogen as well, and estrogen is wildly anti-inflammatory, which really decreases the amount of inflammation in the body, which is why actually estrogen is, especially when it started as perimenopausal, that's why estrogen, when started within 5 years of menopause, huge benefit for decreasing cardiovascular risk because of the down regulation of inflammation. So a lot of times that joint pain can actually be related to estrogen changing. A third sign is skin changes, and what I mean by skin changes is dryness and body odor. And that also has to do with estrogen, because as your estrogen begins to drop, your skin gets dry. And the dryness can be in your skin and also your vagina, and that changes also your microflora. So imagine when people go through puberty, you start to smell different, and a lot of that smell is due to the change in the microbiome in your body. So that'll change your moisture, which can cause itching, but also can change smell. And it's something that is not really talked about enough. The fourth sign of perimenopause that could be happening is just weight gain or weight redistribution. This could be due to a few things, but the first is people say I have a harder time losing weight. And that could happen because there's an increase of insulin resistance with the drop in estrogen. But the other interesting thing too is people will complain about this, and sometimes they'll see their weight is exactly the same. And what they're actually experiencing isn't even sometimes weight gain, but sometimes a weight distribution. And a lot of times it's both. Because when you have a more estrogen dominant physique, you'll have more typical feminine fat distributions, meaning on your legs and on your butt instead of in your midsection. And a lot of times there's a redistribution. And also between that and the stress and the hormone changes, some people actually hold more water. And all those combined tend to have an effect where people seem to think or are actually increasing more weight during this time despite having the same exercise and diet. And that could be in the form of brain fog and anxiety and general mood shifts. So interestingly, estrogen also interacts with serotonin, which is actually created in the gut and affects your brain. So if we think about when you think about very common anxiety, depression medications, it's usually an SSRI, which is a serotonin reuptake inhibitor, or a selective serotonin reuptake inhibitor, which then increases the serotonin in your brain, staying and recirculating longer. When a lot of times if you think about it, I think about 1 in 5 women are on an SSRI, and a lot of times those things could be possibly not given. Again, definitely if you have an underlying anxiety disorder, definitely see a psychiatrist, psychologist to work that out. But a lot of times when you see these new changes of anxiety, brain fog, a lot of times it's an estrogen deficiency. So fixing those estrogen deficiencies can help with that. And a lot of times too, with that brain fog, a lot of times people, when they complain of that, it kind of intermingles with migraines. And when someone also tells me they have a new onset migraine around this time, and they're not someone that tend to have it a lot in the past, or if they told me they have hormonal migraines, like I have patients that are 25, 30 years old, and they tell me, hey, in the second half of my cycle, they tend to get migraines, and it tends to be dependent on the time of their cycle. Sometimes those things become new or more common during this time during perimenopause because of the large hormone shifts. The other interesting part about this is when we're talking about anxiety, there are progesterone receptors on the heart. So a lot of people start feeling tachycardia. So you can imagine how these physical symptoms tend to amplify, tend to feel more anxious. So they tend to play on each other in a very not so great way. It's really important when we're talking about this to, as you can tell, a lot of these symptoms can be caused by many things. So unlike menopause, where you have a distinct definition of menopause, perimenopause is in some ways a ruling out diagnosis, meaning like, hey, if you have low energy and tachycardia, you definitely want to make sure your iron's okay. You definitely want to rule out a thyroid issue. But I will find a lot of the times it's a mix of both, and they tend to interplay with each other. So when I have a patient personally that's going through these things, I always rule out the big medical causes. For example, if you're having those sleep issues, is to try it. We're very quick to put someone on birth control pills just because they're bleeding. We're very quick to give people SSRIs because they're feeling anxious. In my opinion, if I could support someone's hormones and have them not need those other medications, especially when they're new, I think it would help support someone's body with how they were naturally supposed to be functioning, instead of going down these other rabbit holes, and actually fix the underlying cause of the problem instead of causing new things. And I think it's empowering to know that you have more than one option and actually not have your feelings dismissed as just being stressed and life getting the better of you. So it's really important to know that perimenopause is not a disease, it's a transition. You're going from your normal hormone system functioning in a very calculated way to stopping. And in that transitory zone, this is where these symptoms start to come up. And if you are someone, because not everyone has symptoms that debilitate or hurt you, but if you're someone that needs help getting through that transition, a lot of times lifestyle, making sure there's no medical other issues involved. Sometimes hormone replacement can be in some way helpful to bridge the gap to get you there, and also in menopause, but we'll leave that for another video.